Kyla, hi, and welcome.
Do you want me to share my slides first, or you want to do your Q&A before I share?
No, let's do the Q&A first.
Okay, perfect.
Yeah. So I'm going to start by asking you a question about a little bit about your background so that people hear a little bit more about you personally. So I know that you grew up playing basketball, and I know that you experienced firsthand the role that nutrition and hydration played in your personal performance. So what was it about that experience that made you decide to pursue nutrition professionally?
Yeah, well, playing basketball was, I think, showed me a lot of things when it came to nutrition and hydration. Actually, I found out that, I was sucking for air just on a basketball court at relatively sea level for those watching. I'm in California, and it turns out I was anemic. My iron and ferritin were low. And then I was also having a lot of lightheadedness going on. So I was having that, I think the doctor called it at the time, orthostatic hypotension. So my salt was really low, and electrolytes were playing a role. And then a couple years later, it turns out I found out I had celiac as well. So there's a couple of things kind of going on where it's like, okay, that can be fixed by nutrition, and this can be fixed by electrolytes and nutrition, or, we can make some changes in the diet so there's not that intestinal irritation and things like that. So that definitely started getting me tinkering with my diet, nutrition, what was going on. I mean, I really knew nothing then. I was just in high school. It was all self-experimentation, but my dad had me eating like pickles and drinking pickle juice all the time to get salt, and it worked at the time. I don't even know if, I'm sure electrolytes were a thing then, but it wasn't something you didn't see a whole lot of like high school basketball players drinking electrolytes. So that's kind of how my wheels got spinning in it, and then kind of that led me to Davis, which then progressed, and then the passion for sports specific nutrition really was definitely my passion after doing my internship rotations at like the UC Davis Med Center and stuff like that. I knew doing that, there's no way I was going to spend the rest of my life working in a hospital. I just knew that was not for me. And I got to do an internship with Dr. Liz Applegate, who runs the D1 sports nutrition department at Davis. And I just absolutely fell in love, and knew that was like where I needed to go with that. And that, it just evolved from there.
Well, you've come a long way from there.
Yes, all the little steps.
Yeah. And you actually decided, so you've got a really extensive background, in particular on sex differences between athletes and female specific fueling and hydration. So when did you realize that was an area in particular that you wanted to study, and why?
Yeah, I mean, so at UC Davis, as I mentioned, I did my sports nutrition internship there, and that's when I really got focused on the sports nutrition side of it. At the time, there was zero discussion about sex differences in research, in sport. And then following that, I think I was actually, while I was getting my degree, I was coaching CrossFit, and I coached Stacy, or Dr. Stacy Simmons, as most of you guys know her. And she was like, hey, why don't you come on over to Osmo and check out what we got going on over here? And like, I didn't know who she was at the time. I was like, cool, you're just some person coaching my CrossFit class, like, and she was super nice, and like was like, hey, like you should really start looking into this stuff. And she just starts, sending me all these research articles and journal articles and books and stuff on all the sex difference area. And I was reading through this, and I was like, oh my, like this like light bulb went off in my head. I'm like, what, where has all this information been, and why don't we know more about this? And then you're reading through it and you're like, oh my goodness, this makes so much sense. Like, that's why this happens. And that's why I feel this way during the like certain phases of my cycle. So that just like lit a fire in me. And of course, a little like, maybe bias in the sense that I want to know more to help myself. But at the same time, that relates obviously to women. There's a lot of women on this planet. So I think it's definitely an area that we need more information. Definitely more research needs to be done there for sure still, but we're starting to get some information in that direction, and we're going to talk about that today.
I'm excited. I'm excited for it.
Awesome.
So last question before we do start talking about that. So it would be an InsideTracker webinar if I didn't ask you about InsideTracker. So I did mention that you're an InsideTracker pro.
Yes.
So why did you decide to bring InsideTracker into your practice, and how has it helped you?
Yeah, we definitely try and do in our practice a food first approach as often as we can, and we do nutrient analysis and stuff like that with our clients. But there is that missing kind of step. So, for example, like nutrient analysis, we take someone's diet, we put it into our software, we get a spit out, we get to see from a micronutrient perspective what they're consuming dietarily, but it doesn't tell us what's actually being absorbed and what's actually happening at the level of the blood. And so, like touching on the celiac example, and if someone is celiac, there is potentially a higher potential for that person to be low in iron because there's that decreased intestinal absorption. And so we might see, oh, you're getting plenty of iron in your diet and not think to do an iron recommendation. But then when we get some lab work, we can see a little bit more that maybe that iron that they're eating is not actually being absorbed and pulled across. And of course, that plays a big role in someone's performance. So if we can look at that stuff and get just even more detail about the individual and get more specifics about the individual, that helps us just fine tune our recommendations even further. So really helps us detail those recommendations. Yeah.
Okay.
Yeah.
Well, I'm glad it's been valuable for you. And it's something I hear a lot. So we're obviously very excited to have you in the program. So with that, I'm gonna turn it over to you, and I'm sure everyone is eager to hear more about the topic that we have planned today. So Kyla, the floor is yours.
All right, I'm going to share my screen. Okay, here we go. So let's
Perfect.
see. You can see my PowerPoint. Okay, let me get my slides going here. Can you guys see that full screen?
Looks great. Yep.
All righty, here we go. So that's me. So today, what we're kind of dive into basically is a year in endurance and the different training cycles or phases, but how does that translate to a female and what's going on with the menstrual cycle, obviously in a month's time, and how these phases of an endurance season are going to obviously overlap during different phases of a woman's menstrual cycle, and what things we maybe want to take into consideration during these different training phases through the endurance season. So what does a year in endurance look like? We have our off season or post season, which is quickly approaching. We have our general prep season. So that's usually our December to January. We have our specific prep season. So January through February, we will extend that a little bit. And then if we think about a taper week, depending on if you're a triathlete or maybe a runner, I know a lot of the big marathons are happening now kind of in fall. So it's a big range, February to October. February might be some early triathlons, things like that. And it could extend all the way to October, obviously. So we're doing taper week potentially anytime during that period. And then we have our competition phase, which of course can also be anywhere between March, typically, and November. So to kind of give you a quick overview of these different phases as well. So that off-season, post-season, we're not going to actually touch too much on that today. It's typically we're doing a lot of resting, recovering, maybe some maintenance training, maybe we're doing a little cross training, stuff like that. In our gen prep season, we're looking at low to moderate intensity training, typically, maybe some resistance training during that phase. And we'll discuss what nutrition considerations we're going to be talking about and thinking about during that phase. We have our specific prep phase. Again, we'll upping the high intensity a bit, maybe a little bit more specificity, hence the specific prep phase name. You might be doing some altitude training. You might be doing some heat training adaptation in that time, depending on when your race is. And then we have our taper. So your training volume should definitely be decreasing. Maybe there's still a little bit of intensity in there, definitely some specificity, but recovery during this time is obviously critical. Typically, we're thinking about the week, maybe 2 weeks leading up to your event. We really want to make sure that you are recovering from those training sessions really well, and that there's not any low energy, you're not under fueling, you're not under recovering, you're getting adequate sleep, rest, those kind of things. And then our competition day could be a single day event, maybe it's multi-day events. We want to really focus on the nutrition, obviously leading up to that morning, during, and the recovery from those sessions. And then if you're traveling, that's of course an important consideration. And then if there's any ergogenic supplements that we might want to cover there. So now, what does a normal menstrual cycle look like? And I call this a normal menstrual cycle, and that's what they call it in the literature, but this shows 0 to 28 days being a normal cycle. A normal cycle can go anywhere from 35, even potentially up to 40 days. So just kind of keep that in mind. If you fall into that category, it can still be considered normal. But what we really want to focus on here is what's going on here in this luteal phase is going to be most of what we cover today, and where some of the performance implications might be something to consider. So typically from ovulation to the first day of bleeding, we're in that luteal phase. Our progesterone and our estrogen, this orange line here, that's kind of going to be when they're their highest. We have estrogen peaking shortly before ovulation as well. And then we have that follicular phase. So first day of bleeding to ovulation, usually the majority of our hormones are a little bit lower there, and there's less implications when it comes to training performance. If you are on a hormonal contraceptive pill, this is what's going to be going on with your hormones, and definitely something, again, to consider. So a lot of the stuff we're going to be talking about today is going to translate to a normal menstruating female, so not on a hormonal oral contraceptive. So just kind of keep that in mind in our discussion. You can see progesterone and estrogen hold pretty steady until you go onto your sugar pill, and then it drops down. And then if you are perimenopausal or postmenopausal, hormones are going to be also doing a different story here. Progesterone and estrogen, we have that bit of a roller coaster going on. And then once you hit menopause, those levels really taper off. So kind of knowing where you are, and again, what's really going on with estrogen and progesterone is what's going to determine the things we're going to tweak when it comes to training. So what the heck is estrogen, and what is it doing in our body? So estrogen plays a big role in how we really utilize fats or lack of fats potentially. So we'll kind of dive into that. It plays a role on our body composition. It can slow down bone resorption. It also plays a role on our fluid regulation within the system by acting on the kidneys. And it can be anabolic when it comes to protein and muscle tissue. And then we have progesterone. This is catabolic towards protein, so opposite of what we were talking about with estrogen. There can be some brain protective components with progesterone. So BDNF is brain-derived neurotrophic factor and GABA. And then there can be a increased insulin release after carbohydrate consumption when we're in a bit of a higher progesterone phase, that luteal phase, and then stimulates bone formation and has a role in our thermoregulation, or the ability to control our core temperature. So we will definitely dive into that when it comes to some sweat testing, which is going to come up in this general prep phase. So as we mentioned in our general prep phase, intensity of training might be low to moderate. Maybe you're doing some resistance training, but it's kind of that earlier phase of your training season. This is a great time to do some sweat testing, looking at not just fluid losses, but also sodium losses. And this is also a time where we see a lot of coaches suggest training low, fasted training, these kind of things. And I want to dive into that, and if, when, why, what we see in the literature, is that something women should be doing? So with sweat testing, we're going to dive into how to do it, why to do it. But as we mentioned previously, the estrogen and progesterone, or specifically progesterone, is going to play a role on our thermoregulation. So our ability to control our core temperature. So testing your fluid losses, or sweat testing, is one of the simplest and easiest ways to understand how your fluid losses are changing based off of different phases of your cycle. So I do highly encourage my female athletes to test in different phases of their cycle, in that luteal phase when estrogen and progesterone is low, and then again in that I said that reverse. In the follicular phase when estrogen and progesterone are low, and in the luteal phase when progesterone and estrogen are elevated. So we can see how that is playing an effect on our fluid losses. This is something we do with our clients as well. And we do see fluctuations between the phases of the cycle. And some of you may be asking, why does it matter if we test in different phases? And the reason why we like to test in different phases of the cycle is based off of when that individual might be competing. So if we look down several months down the road, and like we have the Chicago Marathon coming up, and the athlete, if their cycle is pretty regular and they can look on their app or whatever, they can see, okay, I'm going to be competing in my luteal phase. Well, then we definitely want to get some sweat testing data in their luteal phase to see how that can translate to race day, and what kind of calculations we need to accommodate for fluid losses, sodium losses, things of that nature. So the simplest means of testing fluid losses is to literally just weigh yourself right before you start your training session and weigh yourself right after your training session. And for every pound lost, we would account that towards about 16 ounces of sweat. So in the example I give here, if we have a 150-pound individual when they start, they lose 3 pounds over their session, that's 48 ounces of sweat loss. If we'll say it's an hour session as an example. Sweat losses can range anywhere from 0.5 liter to 2 liters. So that's 1 to 4 pounds per hour. And I'll say I have seen more. So just to be mindful of that. And this is an area with sweat testing that I do think it is very inter-individual. And I do think it is important people test this, male and female, because I have seen females that lose 20 ounces an hour, and I've seen males that lose 20 ounces an hour, and I've seen females that lose 100 ounces an hour and males that lose 100 ounces an hour. So it is something that I think is very unique to each person. And there's a genetic component to that of, how many sweat glands we have over the surface of our body and stuff like that. But it is, again, something to understand and definitely test for. The other thing I also encourage my athletes to do is test in different environments. So if your race is going to be overcast, maybe you're in San Francisco, the fog is out, it's cool and breezy, that is something that can we test in that environment? Or is it going to be a trail race and it's, up at elevation, or it's hot and dry and it's summer? Test in that environment as well, so we can see these differences that will be occurring. And as an example, I had a client recently, we tested the individual just from a degree perspective. The individual did a run in 70 degrees and she lost 45 ounces an hour. She went and did that same run, but 15 degrees warmer. So it went from 70 degrees to 85 degrees. And she lost 100 ounces an hour. So she more than doubled her fluid losses in a 15-degree temperature increase. So again, definitely something to monitor and see how that plays out for you. And that is definitely some data to track, so you know how to control that during the session. If you're losing 100 ounces an hour, definitely more than likely not going to consume 100 ounces an hour to minimize those losses. So again, definitely testing and kind of finding out where you're at. And again, cycle phase dependent. Do you see big differences there from a fluid loss perspective? The other thing we like to look at, in addition to just fluid losses, is sodium losses. And again, testing in different phases of your cycle is important, because we do see that total body sodium can actually go down during the luteal phase. So you might actually see, if you do some sweat testing in that luteal phase, your sodium losses are actually a little bit less. And again, something to account for when you're planning your hydration and your nutrition for that race or for training sessions during different phases of your cycle. Maybe you don't need quite as much sodium, or vice versa, depending on what your sodium and fluid losses are. Common sodium testing ways for the public right now are these Gatorade patches. I don't have any affiliation, but that can be a great way, as opposed to going into a lab and doing a whole body washdown method, as they call it, would be kind of the most accurate. So long as you use these properly. There can definitely be some room for error with these, but it can be one of the tools. And when it comes to sodium range losses, again, can be very individual. I have seen anywhere from 200 milligrams per liter of sweat up to 1600 milligrams per liter of sweat. So just to kind of, again, keep that in mind, and is very typically individual. So as I mentioned, sodium losses are going to change in different phases of your cycle, and that usually has to do with progesterone. So again, progesterone is higher in that luteal phase. It's peaking. It has that effect on our thermoregulation, our ability to control our core temperature. So we typically run with a slightly higher core temperature during the second phase of our cycle. So if we're running a little hotter, is our heart beating a little faster? Does that mean we are trying to sweat a little faster? Are we trying to cool ourselves a little bit hard? Like, are we working harder to cool ourselves? And what's going on with the fluid and the sodium at that time? So again, testing to find out how that applies to you, but typically we see that change from phases of the cycle. So fasted training, what do we do? So again, gen prep phase. This is a time where a lot of times we see coaches suggest doing some fasted training for purposes of increasing maybe your fat utilization or your aerobic efficiency and things of that nature. And what I want to kind of dive into here is, whether or not this is beneficial potentially for women or not. And so what I will say is that large percentage of the literature showing the use of these different training methods. So whether it's fasted training, training low, training high, sleeping low, double days, depleted days, things like that, is done on men. So just something to be very mindful of. And like, why are we doing it? And what are we seeing in the literature? So a lot of literature, we will see an increase in this activity of AMPK, but we don't necessarily see an increase in performance, even for men. So it is something I think we just want to think about and consider. So in a piece of literature I came across here, they did a questionnaire style of about, I think it was 2,000 participants here. And they asked if they trained in a fasted state, men and women. And we had 62% say that they train in a fasted state. And I know there's different reasons for this. Maybe some people maybe it's a very easy session. Maybe you don't want to have any GI issues or any gut discomfort. But I think this is something we do want to consider, and it might not necessarily be the best idea for women. And I will show you why. So in a large literature review of the different training methods, I tried to highlight here, but you'll see that these are small studies. So just 9 individuals here. I think there's 20 here. And you'll see that they are all men. And this column here on the right is going to break down whether there was a performance benefit. So this kind of chunk here that I've shown on this page is all looking at the different studies that have been done specifically on fasted training and what the effects were specifically on men. And so we see there was some changes in AMPK activity based off of the different methods that they utilized, but there really wasn't any improvements in performance. It was like the improvements were in both groups, whether they were fasted or not in the men. And then if we look at our train or the sleep low, which is also called train high sleep low, you'll see again, small study group, men. And this is our performance improvement column. And again, no data to show here for specifically performance improvements, but again, we did see some improvements in AMPK. And then there's more studies on the train high sleep low. And again, we have more men, cyclist men, triathlete men. This was the only method that did show actual performance improvements. But again, men. So just kind of be mindful that when we do this, what do we see? Who do we see it on? And what was the specific way they did it? And it was they trained high. So in the evening, they did it looks like 8 by 5 minute cycling. I think they did cycling down here as well in this other study, but 8 by 5 minute cycling. Then they didn't consume any carbohydrates following. Then the next morning they woke up, did not consume any carbohydrates, and did a 60-minute bike ride at 65% effort. And they did see improvements in their performance in those two groups. Again, men, and it was the train high, sleep low model. So again, just something to consider. I have a lot of questions about this, like where is the research on women? Do we need to do this because we have a higher oxidation already of fats as women compared to men? And is this something that in reality will benefit us or not? I haven't seen the literature yet, but I have a lot of questions. So if I see any, I will be the first to show it. If anybody else has ever come across any, please show me as well. I'm more than curious to see that. But as mentioned, we do utilize and oxidize more fats than men across the board. And then during our higher hormone phase, or that luteal phase, because of that elevation in estrogen, we do oxidize less carbohydrates and will utilize more fats, even more so than during that phase of the cycle as well, even during exercise. Just again, keeping that in mind. Now we're going to jump into that specific prep phase. So again, intensity of training is probably going up, definitely a high specificity. There's some altitude training potentially going on. Maybe you're doing any heat training. This is definitely the time for gut training. I apologize if you hear my dog in the background. So again, gut training could be something that we'll utilize based off of the information we got from our sweat testing data. So for example, maybe you find out that you're losing 80 ounces of fluids an hour, and we have you doing a marathon, and we want you, your goal time is, we'll say 3 to 4 hours or something like of that nature, then we might be wanting to push your gut training to tolerate somewhere between 60 to 90 grams of carbohydrates per hour. But right now you might be only consuming maybe 20, maybe you're only taking one goo in an hour or something like that, or one gel. And so that's something where we definitely want to slowly train you over a period of time. And this is that specific prep phase time where we want to do that to get you to a point that's maybe past where we actually want you to be on race day, depending on the duration of your event and what we're seeing from a fluid loss perspective and a carbohydrate and a sodium perspective as well. And then of course we want to monitor our iron levels, and we'll dive into that and watch out for some low energy availability as the training ramps up. So as I mentioned, definitely a great time to do that gut training. The purposes for this gut training too is we do see women tend to have a little, I should say, be a little bit more prone to lower GI issues when racing compared to men, maybe might be a little bit more prone to upper GI issues when racing. And we can absolutely train the gut. And we've seen this in the literature with both men and women. And by training the gut, what we're doing and what we can see in the literature is we are able to increase gastric emptying, so the rate that the stomach empties into the small intestine. And then we can also increase the intestinal absorption rate for nutrients as well. So now the stomach is emptying at a faster rate, but we're also able to upregulate basically the carbohydrate receptors at the intestinal lining to pull those faster coming in carbohydrates essentially across the border. So an extreme example of this would be if we have someone who is following a keto diet and then they get to their race and they try and slam down 60 grams of carbs per hour. That's going to be very problematic because they have not upregulated the carbohydrate receptors on the intestinal lining to tolerate that volume of carbohydrates. They've been basically training their gut to downregulate those up until that point. So by doing gut training, and then also as we kind of get into that taper week where we might carb load, those all help upregulate our ability to pull carbohydrates in more efficiently and effectively. And as I mentioned, checking on those iron levels, this is definitely the time you want to do that. Again, menstruating women are going to be more prone to low iron and low ferritin levels because they're losing blood every month. But also as an endurance athlete across the board, we tend to have a harder time maybe even absorbing the iron we are getting from our diet because of our training, increasing something called hepcidin. Hepcidin is a molecule that basically interferes with the iron molecule binding and basically being absorbed. And every time you train and exercise, that hepcidin upregulates, and it can stay raised for 6+ hours after endurance activity. So if you are doing a supplement or you're trying to time your iron-rich meals, it's kind of making sure you're timing those appropriately based off your training time. And that ends up looking like trying to err towards either earlier in the day or immediately after you finish that training session before that hepcidin starts to peak. Can be prime times to get the iron in if you're having low values. And if you are low, hence using InsideTracker to test that, right? If you find out you're low, it can take quite a while to get those levels back up, depending on how low you are. So testing early into the season is really helpful to give yourself enough time to get those levels up to a range that you want them at. And then, as I mentioned, during this phase, we're upping the training intensity. So we do want to make sure we're matching the nutrition to support that and watching for any low energy availability. So again, jumping back to that questionnaire of about 2,000 participants, we had them ask, do you intentionally and purposely eat more food or calories on hard training days or the day after hard training days? And 37% of people said no. And so in reality, I mean, that could be 37% of people missing the mark when it comes to periodizing their nutrition to support these training loads and training volumes. And this becomes really important, definitely when we're talking about keeping a regular menstrual cycle, because low energy availability over a long period of time definitely can be one of the things that can result in amenorrhea or loss of a menstrual cycle. And it can also, of course, lead to like increased injuries, bone breaks. Maybe you're getting sick more regularly. Maybe you're feeling under recovered from your training session. So definitely something we want to keep an eye on and make sure we're matching that nutrition intake with the training output, I should say. So now we're going to dive into our taper week. So something to consider with the taper week is, we'll dive into carb load, but we're going to be decreasing our training volume. Our intensity might still be a little bit there. Again, very specific, of course, as we approach the event. And then recovery is going to be really critical during this time. So in our taper week, do we carb load or not? And what does the literature say? What's the deal? Should women do it or not? And so I'm just going to show you some of the literature and how it's evolved over time. So the standard recommendations for carb loading, these were done on men. There was kind of two approaches. One was to do 2 days prior to your event, consume 8 to 12 grams per kilo. And the second method was to do a glycogen deplete. So basically you would go very low carb, you do some hard training sessions, utilize all your body's glycogen stores, and then load with carbohydrates. And that was a bit of more of a multi-day. So that might take a week's time for you to deplete and then load for a couple days before your event. The deplete and load was shown to be effective, but specifically for untrained males, which is not a huge majority of the people we come, where usually you guys are training for a good amount of time before an event, but that's effective for untrained males. And then the 2 days pre-event was shown to be most effective for trained males. So remember that range, 8 to 12 grams of carbs per kilogram body weight. So there was some research that was brought up recently that looked at if women and men keep their calories the same, meaning as they go into their taper, they're not increasing calories for carb loading, but rather just shifted the ratio of the calories they were consuming to be a little bit more carbohydrate dominant, to the point where they're hitting about 6.4 grams per kilo. Women did not see an increase in their ability to glycogen supercompensate similarly to that of men, but they did see a 5% increase in their performance on a 60-minute cycling time trial. So there was a little bit of in performance, but the amount of glycogen stocked in the muscle was not quite as effective as that seen for men. So then there was a study that had both men and women consume 12 grams per kilo. And this did show an effect where both women and men were able to get glycogen in their muscle to the same level. So what we see now and kind of realize is that women can't keep calories the same during a taper. They do have to increase that caloric intake by, we're saying, about 34%, and be somewhere at 8 minimum plus grams of carbohydrates per kilo to have a similar glycogen loading as males. And this needs to be done specifically for 4 days prior to the event. So whereas men can get away with like one big day of loading and then eat normally 1 day out, women need to be at a higher intake for 4 days prior to that event. So something to just keep in mind. So now we're jumping into the competition phase. So things to focus on, whether we're doing some travel, nutrition for travel, if we're prepping pre and post and of our event, and then if we have single multi-day events, and then if there's any supplement discussions to support that performance. So we'll start with our supplements. So common supplements that we might suggest for our female athletes are going to be things like Tart Cherry utilization, nitrates, and creatine. In Tart Cherry, the reason why we suggest this guy is there was a study that looked at actually both men and women triathletes. And we do know that women, menstruating women during that luteal phase, can have a increased likelihood of getting sick. We also know just athletes across the board, when you do a big event, a lot of times you train, you have your race or your event, and then you finish, and then the next day or two you get sick. And that is something that is definitely more prominent if a woman is racing in her luteal phase. So when progesterone and estrogen are elevated. So we utilize this Tart Cherry 480 milligrams 10 days around the endurance event, just like they've shown here in the literature, for that immune support. We also saw other benefits as well. So reduced inflammatory stress, they had an increased performance, and there is decreased muscle damage, which is awesome. And the reason for the immune response too is there's in the luteal phase, there is an increased leukocyte response specifically, and we'll dive into some other ways we can help manage that leukocyte response as well. So nitrates help with vasodilation, or opening up of those blood vessels. And this one is going to actually apply mostly to our perimenopausal or postmenopausal athletes. And that is because as we get older, our blood vessels don't tend to respond as rapidly as we'd like, unless, I should say, you've been training since you were young and you're a well-trained individual, if you will, into perimenopause and postmenopause. Your vasodilation effects should be a little bit better when compared to maybe someone who started training later in life. So keeping that in mind. And this can be a tool that you utilize 7 days leading up to your event. It could be something too that you use on a singular dose in just 2 to 2.5 hours prior to a training or racing event. So helping, again, open up those blood vessels so that oxygen, nutrients can work, will get to the working muscle tissue effectively. And then creatine is a really interesting one that we're seeing more and more literature come out on, and specifically to females too, which is amazing. And one of the reasons why we like to suggest creatine is women have a significantly less stores of creatine compared to men. And we do see that when women supplement with it, menstruating, so premenopausal, not perimenopausal, so menstruating women, they see improved performance in strength and their endurance exercise. And then when we utilize it for postmenopausal, we do see benefits in our skeletal muscle, and then specifically our bone strength when we are doing strength training paired with that. And that's a 0.3 grams per kilo dose. There is some suggestion for creatine loading. You may have heard of that before. And specifically for the premenopausal or menstruating females, you can load at 15 grams a day for 5 days, and then shift to a maintenance dose of 5 grams per day consistently. And that is something where, if we're talking about timing, there is the ever so slightest bit of literature to suggest consuming your creatine post training might have a slightly better absorption rate. So if you are doing a recovery shake or Greek yogurt, you can mix your creatine in there or put in some water. It's pretty flavorless. And then it also has benefits for mood and cognition as well. And this is a graph I just loved from Amy Smith Ryan that breaks down just creatine, how it actually fluctuates throughout our menstrual cycle. So it's this dark solid black line. So you can see it's actually lowest during our follicular phase. And then we have a peak around ovulation, drops down, and we have a little bit more steady around luteal. So something to just kind of keep in mind. I haven't seen any in the literature yet saying to time your creatine intake based off of cycle phase. I think it might be more of a consistent regular daily dosing at this time, but definitely something to keep our eyes peeled for. And then touching back on that luteal phase immune system response with the leukocytes that we talked about with in regards to the Tart Cherry, is we do also see, we definitely always want to recover well post-training when it comes to our carbohydrate intake, but definitely that becomes important even more so during that luteal phase. We see that when carbohydrates are consumed immediately following exercise, that the leukocyte elevations are managed a bit better, and we don't see as much of a immune response there when we can get those carbohydrates in. So if we're thinking about how much carbohydrates do we need to get that response, if you aim for about 1 to 1.2 grams per kilo. So as an example, if we have a 150-pound athlete, that could be anywhere from 68 to 80 grams of carbohydrates. I will also suggest that you definitely pair some protein, of course, with your post-training recovery shake. That's another piece of this. When we think about touching back to the catabolic and anabolic effects of estrogen and progesterone, we do want to make sure we start turning down that muscle breakdown, start that muscle reparation. So it could be anywhere from 30, maybe even up to 40 grams of protein dose that we're looking for our female athletes post training. And that would apply, typically I err on the higher end, that 40-gram dose for my perimenopausal and postmenopausal female athletes. That gives us enough of that leucine, that amino acid leucine, typically, so long as, we always want to double check the amino acid profile on the protein, but or food source that you're getting it from, that'll turn down, have enough of a response to turn down that muscle breakdown and start muscle reparation. So now kind of overall things to consider if we are talking about, we're talking with InsideTracker, so we definitely want to talk about labs, but something to consider as a female athlete too, if you are getting labs done throughout the training cycle, it is definitely something we suggest, as we mentioned, definitely monitoring that ferritin early on in the season so we can make changes, but keeping in mind that there are a few markers that are definitely going to fluctuate based off your menstrual cycle phase. So if you are able to retest, is to try and potentially retest in a similar phase of your cycle, just to keep things as consistent as possible. And some markers that you might notice changing are going to be that testosterone, your cholesterol, ferritin, potentially vitamin D, and your inflammation marker, that HSCRP. So just kind of keep that in mind when you are testing. And then to summarize from today, you definitely want to take your different training phase cycles into consideration based off of menstrual phase, but also training phase and what's going on there and how we want to adjust our nutrition, our sweat testing, our fluid intake, our sodium intake, our managing our thermoregulation, how that all plays into what phase of training we're in and what's going on with where we are in our menstrual cycle as well. So we can work with our physiology, with our, by adjusting our nutrition, our hydration, and then definitely don't skimp on your carbohydrates when it comes to gut training, when it comes to recovery and immune system response, all of those things, we need those. And it helps, again, with that immune system response, definitely so in the luteal phase as well. And then we have our references for today and Q&A. I think I went fast, but I hope you guys enjoyed it.
It was perfect timing.
Okay.
Left just enough time for a Q&A. So thank you, Kyla. That was really wonderful.
No
so
problem.
what I want to do is I'll just read off the questions. So there are a handful of questions in the chat. So I'll just read them off and then I'll give you a chance to answer. Sound good?
Perfect.
Cool. So the first question is from Madeline. And the question is, how would guidance differ for lactating athletes?
Oh, that's a good question. This is a tricky area because there's definitely very little research in this area because it's hard to test these individuals. It is something where if you are breastfeeding and your cycles have come back, you might be able to have a little bit clearer of a picture of maybe where you are in your cycle, of course, and what's going on, but that's not always the case. So that would be a tricky one. The way you could potentially get some tools would be you could do like basal body temp tracking, and that might give you a little bit of a picture of what's going on with core temperature and maybe how that can translate into your thermoregulation, maybe your fluid losses, sweat losses, things like that. That would be kind of the something that comes to mind in that population group. It's a good question, but yeah, definitely more research needs to be done in that area. It's just hard to get participants for that kind of stuff, unfortunately.
Thank you. So next question is from Rachel, and Rachel is asking, when doing a sweat test workout, you shouldn't take in any fluids during the workout, right?
That's a good question. It would make the math way easier if you didn't take in any fluids for sure, but you absolutely can hydrate, depending on the session duration, but you have to account for that, right? So that is when you consume fluids, obviously it's adding weight to the number on the scale. So you'd want to do some measurements of how many ounces are you consuming, and then what does that translate to in ounces lost? And basically you're adding that back in. So now it's more weight actually in reality that you lost. It's a good question.
Makes sense. Okay, so Nancy is asking, she's first stating, dietary intake can directly and significantly influence oxidation of various fuels for exercise as measured in metabolic testing. What is your position on keto, and similar for women? Is there any benefit for female athletes, either for general health and for performance?
That's a good question. Yeah, she's right on. Yeah, your diet is going to predict how your body utilizes fuel sources. That's absolutely true. Position on keto for women, if you're a female endurance athlete, and you're a menstruating female endurance athlete, and you don't have something like PCOS, I tend to err away from it just because of the stress to the system. And definitely if you're someone who has lost their menstrual cycle and maybe is amenorrheic, I think that's definitely something we would want to look into. In terms of benefits for female athletes doing keto, no, the literature hasn't shown that yet. The literature hasn't shown keto at all, men or women benefit. So that is something that I don't. We'll see. I'm always looking for the literature. So if there's something out there, I want to know about it, but I haven't seen anything that shows performance benefit. Again, kind of subset, of course, there are certain situations, PCOS, sometimes that can be a situation where the individual might benefit from a keto diet, and trying to kind of fine tune how that would work being an endurance athlete as well. That would be something I would suggest working with a professional to kind of fine tune that. Good question, Nancy.
So the next one is from LM. And the question is, what about weight gain and bloating with creatine?
Good question. So that is, it can happen. There is, I would say the majority of the research looks at specifically creatine monohydrate. So I would say make sure that you're utilizing a creatine monohydrate and not like a crealkaline and stuff like that that's out there. With the water weight, like bloating that can happen in the muscle tissue, there's actually quite a performance benefit to that. I know as women, maybe we don't love to have like fluid retention going on or feel that feeling. But what's really cool about creatine and what it's doing is by putting more, it does a couple things by allowing us to retain more water, but also by it increases our ability to glycogen load in the muscle as well. So if we can put more energy and more hydration in our muscle tissue, this actually sustains us and delays our dehydration and our glycogen depletion in endurance events. So although we don't love the bloat, it can absolutely benefit performance for that perspective, unfortunately.
Got it.
Mm-hmm.
So next one is from Angela, and Angela is asking, thoughts on taking in liquid calories during competition, or is it preferred to keep hydration and calories separate?
That's a good question as well. So this is an area where there are definitely different schools of thought, food in the pocket, hydration in the bottle, kind of. I do think that you can absolutely do that. And you can train to do either thing, I will say. So you can gut train to go either direction, right? If you gut train to rely on liquid calories, you can gut train to do that. And if you prefer to keep it separate and that works for you, you can gut train to do that as well. I think what it comes down to is the athlete and their availability and access during racing. So for example, if I have an endurance athlete, that's bent over in the aero position and can't reach back and grab, things of food out of their pocket, or can't even carry it on their bike, then it's a different conversation we need to have, because we can program all the suggested food that we want you getting. But if you literally cannot get it into your body because you can't reach it, or you don't feel comfortable taking your hand off the bike, or, something like that, that's definitely a consideration we have to keep in mind. And if you want to mix those up and train appropriately to tolerate those things, I think it can be done. And we're seeing that when it comes to gut training in I mean, all kinds of different sports. I mean, for the longest time, we thought that 60 grams of carbs per hour was like the max anybody could tolerate. Nobody's gut could tolerate anymore, or you'd have issues. And then sure enough, like you mix your carbohydrate sources and now we can tolerate 90 grams of carbs per hour. And then now we're seeing in like Tour de France, these guys are consuming 120 grams of carbs per hour. So you absolutely can train your gut to tolerate those amounts, and again by increasing that gastric emptying and the intestinal absorption, things like that. So I think there's different ways to go about it, and it's so long as you train. So you can train to go either way, and what's going to work for you and what can you carry and access and get in your mouth, basically, is what it comes down to.
Yeah, so it sounds like it's pretty individual, but critical consideration is to train the way you plan to race.
Yeah, definitely.
Yeah. Okay, and then the last question that we have is from Kyla Long, and she's saying maybe a dumb question. I'm sure it's not a dumb question, but how might you tell what part of the cycle you're in and how you should adjust nutrition if you don't have normal cycles, e.g. IUD?
That's a good question. So if you are on whether it's a Mirena IUD that has hormones or something like a copper IUD that doesn't have hormones, IUDs are definitely different than an oral contraceptive in that your ovaries can still do their thing when you have an IUD, meaning they can still release their hormones. So if you're not having a bleed, what you can do, because you are still getting that hormone release, is that I would, touching back to the basal body temp tracking, I would use that as a tool. I think too, certain devices now, I don't know if it's Apple or Whoop or somebody, they're starting to put in temperature sensors in their devices. And maybe I haven't played with it yet, but this would be a cool tool to use on women to see, like, can we see the different changes in our cycle? But if you get a basal temp thermometer, so it reads out a couple decimal places every morning, I know it's a pain, but you lay in your bed, you scroll your iPhone or whatever, pop that thermometer in your mouth, and then you can log that in an app like Flow, for example, and it tracks your temperature over your cycle. And basically in your low hormone phase, as we mentioned, I see Nancy says, Whoop has the temp sensing, yay. I can't wait to test it. Is that in that follicular phase when hormones are low, we should see the data points be a little bit lower. And then when you ovulate, we should see this pretty big jump. And then it's going to hold slightly higher, right? Because we have that progesterone playing that role on our ability to thermoregulate, causing that higher core temperature. So it should kind of look a little steady, jump up, and then hold steady a little bit higher. And when you're on an IUD, you would really be able to see what phase of your cycle in and how to make those adjustments. And also you could plot that, and how is it quote unquote normal, although you have an IUD and no bleeds? Like, are your cycles changing? Is it 28 to 40 days that you're seeing these temperature changes? And then you could really potentially plot that down the road for races to kind of fine tune that. That's a really good question.
So we've got 2 minutes, so I'll try to sneak one more question in here from Rachel. And Rachel is asking, is there a way to train to minimize lower GI issues that can occur during the first days of the cycle?
That's a great question, Rachel. So definitely with any of our athletes, no matter the cycle phase, for an event or maybe it's a long weekend run, we always try and do I call it a fiber drop, where we significantly drop fiber, definitely at least one day before. But if you are more prone to lower GI issues, maybe you need to drop fiber 2, maybe even 3 days out. And again, that's something I would plan to test with. So you always want to do like practice race simulations where you go through the whole race week protocol, all of that stuff, carb loading, everything, and practice and see how that plays out on your simulation. So I would keep fiber below 25 grams. This is a time where I do encourage my clients to food journal so they can make sure that their carbohydrates are not, their fiber is not exceeding, because basically anytime we're having lower GI issues, those tend to be what's been consumed in the 24 to 48 hours prior. We've created bulk basically in the colon that is causing like a bowel movement. And so we want to minimize the bulk in the colon. So we want to decrease the fiber intake. So it is one of those things where sports nutrition seems almost so backwards than general health nutrition, but it's you really want to cut the fiber in those 24 to 48 hours. So limit the veggies, limit the beans, limit the whole grains, like stick to the simple white rice, and maybe you're doing some, I don't know, homemade pancakes and waffles and a couple bananas, like keeping that fiber really, really low to minimize that bulk in the colon. And then specifically with menstrual cycle stuff, as opposed to like any other time of the cycle, is that they're typically what can happen is the prostaglandins, if there's elevations in the prostaglandin releases, basically they attach to any smooth muscle. So typically they attach to the uterus, and then it causes the smooth muscle of the uterus to contract and shed the uterine lining. But if we have excess prostaglandins, they will attach to any other smooth muscle. Well, your colon is smooth muscle, so it can attach to the colon and cause the intestinal cramping, right? So trying to decrease that prostaglandin, the inflammatory prostaglandins, it could be looking at, incorporating maybe it's omega-3s into your diet and things like that, or even just the week before to decrease that prostaglandin activity. That's a good question.
Thank you, everyone. It sounds like there were a lot of good questions. So thank you for all of your questions, everyone that participated. I see one from Sylvia that I can answer. So Sylvia's asking where this recording is going to be posted. She'd love to share it with teammates and some family. So this week we expect to post the recording on YouTube, and then if you've registered for the webinar, you will also receive an email with a link to that recording. So stay tuned for that later this week.
Awesome.
So with that, we're going to wrap up.
All right.
So Kyla, I really want to thank you again. This was really, really wonderful, incredibly insightful. I'm sure that everyone who joined us learned a lot today. I know I did, and I share your hope for more research on this topic. I think it's much needed.
Yes.
But
yeah.
In the meantime, really glad that you're bringing this to the forefront and sharing the data that is available. So thank you so much, really.
Awesome.
This was really great. And thank you everyone for joining us.
No problem. Thanks. Yeah. Thank you everybody for attending. Thanks, Rowie.
Bye now.
Bye.